warm welcome, everyone, to the launch of the Global Access to Nutrition Index 2021, and a special welcome to our board, funders, and the speakers of today. My name is Marije Boomsma, and I'm the Program Director of ATNi, and I will be moderating today's event. In the next 1.5 hours, we will share the key findings of the 4th Global Index with you. To start, we'll have a few words of introduction by Paulus, Verschuren, who is the chair of ATNi's board. After this, Darren, Welch, Director of Global Health at the Foreign, Commonwealth and Development Office, FCDO, which is one of ATNi's core funders, will also say a few words. After the introductions, Inge, Executive Director of ATNi, will present the Global Index 2021 findings with you. A panel of 4 speakers will respond to the index findings, and our panelists are Hanne Sundergaard, who is the Chief Marketing Officer and Executive Vice President at Adela, one of the companies that is assessed in the Global Index. Then Frank Wagemans, who is Senior Engagement Specialist at Achmea Investment Management, and also ATNi Investor Signatory and co-chair of the ATNi Collaborative Investor Engagement Group. This will be followed by Dr. Rajan Sankar, who is the Director of Nutrition at Tata Trust and also member of ATNi's board. Our 4th speaker of today is Gronya Mary Moloney, who is Senior Nutrition Advisor at UNICEF. The panel presentations will be followed by Q&A. A few of ATNi's key partner organizations have submitted questions prior to this meeting, which we will discuss. And also the audience can pose questions during the full presentation time in our Q&A function of Zoom. And our ATNi team is at your disposal to directly answer your questions, or the questions will be answered by our panel. A final note to bring to your attention is that this event will be recorded. But now over to this meeting, and I'll give the floor to the chair of ATNi board, Paulus Verschuren. Paulus, over to you.
Thank you very much, Marije. Welcome to everyone to this launch event of the Global Access to Nutrition Index 2021. As Marije said, my name is Paulus Verschuren. I'm the chair of the ATNi board, and it's a pleasure to be here together with ATNi, a global initiative which I could help establish with GAIN back in 2010. To this day, malnutrition in all its forms continues to affect vulnerable people all around the world, and COVID-19 has increased the urgency of fighting malnutrition. Research has shown that overweight and obesity increase a person's risks of hospitalization and death due to COVID-19, and the prediction is that next year, COVID-19 will result in more hunger and more malnutrition. More children that are wasted, more children that are stunted, and more children dying of malnutrition. We cannot allow this to happen. So what is it we can do? What is needed and who should contribute? Food and beverage companies naturally have an important role to play in promoting better diets for all. Since the first global index was launched in 2013, some companies have taken important action towards better nutrition, integrated nutrition in their policies and practices, developing nutrition profiling systems to measure the healthiness of their products, and companies are developing healthier options. But one question remains: are companies today doing enough to achieve the Sustainable Development Goals of zero hunger and good health and well-being by 2030? Are they doing enough to serve the real needs and wants of the malnourished people in the world? The Global Index 2021 will give you valuable insights into how companies perform, what they need to do better, and how they could do that. The index is published in full online and reveals industry best practices that all companies can and should learn from. COVID-19 has shown us how vulnerable people are and how important it is that they have access to healthy food. Let me say this, there's never been a greater opportunity for all the food industry to step up the positive changes needed to ensure healthier diets for all. The Access to Nutrition Index is providing a unique tool for companies to do better and for all stakeholders, including the investment community, to hold companies account. I urge all stakeholders involved in nutrition and health to use this research to build back better. Finally, on behalf of the board of ATNi, I would like to thank everyone who is contributing to making this index possible. And let me now give the floor to Darren Welch, the Director of Global Health at FCDO, formerly DFID. And Darren, the screen is yours. Thank you.
Thank you very much, Paulus, and a huge welcome to everybody, wherever you are, from a very sunny London this afternoon here in London. So yes, I'm Darren Welch. I'm the Director of Global Health at the UK's Foreign, Commonwealth and Development Office, and it's a huge pleasure to be here with you today to mark the launch of the Access to Nutrition Initiative's 2021 Global Index report. And I think over the years, this report has earned itself an enduring place in the nutrition landscape and demonstrated its enormous value and worth. And it's always possible when you have these sorts of indices and ranking to quibble a bit about where individual organizations should be. But actually what they do is these indices give us a basis for a conversation. They give us analysis to draw on, and having that conversation is so powerful as we develop public and private policy. The index also gives us a sense of direction over time. Are we improving? How much further do we need to go? Who's making most progress? Who needs to do a bit more? And of course, I think it also gives us some valuable geographical insights to where the best practice is housed. So we welcome the progress that's been demonstrated in this year's report, and some companies have clearly done well. There is some progress. We'll come to that perhaps in a moment. But this agenda matters, as Paulus has just reminded us, and it matters enormously because good nutrition is crucial to enabling people to fulfill their potential and to cope with various shocks. And we've seen that, of course, with the current pandemic. And it also allows people to live healthy, resilient lives and to build globally sustainable and prosperous societies. But we've got a long way to go. All forms of malnutrition are alarmingly high still, with huge costs to individuals, businesses, and economies. And we're seeing increased food insecurity and undernutrition at the same time as we're seeing rising obesity in many low and middle income countries. According to the FAO, 3 billion people were unable to afford a healthy diet last year. And the situation, of course, is expected to have got worse as a result of the coronavirus pandemic. In tackling this crisis, the world's largest food and beverage companies have got a critical role to play, helping to improve diets and tackle malnutrition. And they do that in a number of ways, whether it's the products they supply to market, the way they shape and influence consumer demand, the way they treat their employees or operate across their wider supply chains. Their actions matter more now than ever as the world continues to struggle with the various impacts of COVID-19. And as I said, many businesses have got great practices to share and they're making positive contributions. There's a growing realization that doing good in business is in fact long-term good for business, especially in a world of increasingly engaged and demanding consumers. The index shows, though, overall relatively limited progress over the last year. Some companies have made good strides, and we recognize and celebrate that, but there's still a long way to go. We need to see more investment in nutritious foods and efforts to make those foods more affordable and available, particularly in developing countries. We need to see more responsible marketing practices and greater efforts to improve nutrition in the workplace and across the entire supply chain, especially for women. And this is where ATNi has a really important role to play, as it helps inform our policy dialogue, helps us assess the progress that's being made and to recognise the areas where good practice exists. It can encourage companies to do better. It is the only independent, comprehensive mechanism in the world to hold business to account for their actions on nutrition. And we value it highly. We value it highly because it's a powerful instrument to help drive change. It shows companies where they have opportunities to improve. It shows governments where we should focus our efforts on policy and regulation. It helps investors have more information as they consider where to make their investments and how they and when they increase their accountability to their own customers. And of course, it helps the entire nutrition community understand where to target efforts to support greater private sector impact on nutrition. So I very much welcome this year's report and this event to launch it. I encourage us all to support and draw on ATNi's work as we try to move forwards in the important work of improving global nutrition. We need to spread the messages in the report, highlight and celebrate the good practice, identify where more needs to be done as we try to drive change across the business community, working in partnership and in strong collaboration. And this year, of course, with the UN Food Systems Summit coming up and the Nutrition for Growth Summit, we've got a great opportunity to push forwards on this important agenda. The UK, for our part, we will continue to promote a strong and positive business contribution to improving global nutrition, and we're going to continue to support the vital work that ATNi is doing. So thank you very much for allowing me to make some remarks, and I wish you all the best for a useful set of discussions today. Thank you.
Thank you for your very important and inspiring words, Paulus and Darren, and it's really a pleasure to have you here today, so thank you again. It is almost time to go to the presentation of the Global Index 2021 by Inge. However, we will first show a video introducing ATNi and ATNi's mission and vision.
Malnutrition in some form affects every country in the world.
1 in 9 people is hungry or undernourished.
1 in 3 people is overweight or living with obesity.
2 billion people lack essential micronutrients such as iron, vitamin A, vitamin D, and zinc in their diets.
Over 800,000 infant deaths could be avoided each year if they were optimally breastfed. COVID-19 has exacerbated all forms of malnutrition.
Women, children, marginalized and low-income groups are most at risk of malnutrition.
It is estimated that by 2022, the pandemic might lead to a 2.6 million increase in stunted children.
With a retail value of nearly $2.5 trillion in 2020 and a scope that reaches virtually every individual on the planet, the packaged foods industry has a significant impact on nutrition globally.
The Nutrition Year of Action comes at the right time to urgently transform food systems and promote better diets for all.
ATNi is a non-profit organization that develops tools to track the contribution of the food and beverage sector to address the global nutrition crisis. Our engagement with companies and other parties are all focused on driving positive change.
ATNi's
strategy involves 4 work streams.
Our global indexes provide comprehensive analysis and ranking of the world's largest food and beverage manufacturers in addressing the global nutrition crisis. Each index includes an assessment of each company's product portfolio. For baby food companies, it also includes an assessment of the marketing of breast milk substitutes and complementary foods.
ATNi develops accountability tools and programs targeting large and small companies in individual countries. ATNi collaborates with organizations to produce specialized accountability tools and research to feed into existing benchmarks and initiatives.
Finally, ATNi engages in action research to zoom in on new nutrition topics and develop knowledge to fit into new indexes and tools.
Institutional investors are key users of our work. ATNi has over 70 investor signatories with $15.5 trillion in assets under management, who use the results of our indexes in their research and engagement to guide responsible investment.
With a growing number of impactful publications, ATNi is a unique global accountability organization for business action on nutrition.
ATNi invites you to use our tools to drive change towards a vision of the world where nobody goes to bed hungry.
A world where everyone eats a healthy,
affordable diet that has all the nutrients needed
to grow and develop fully.
Thank you all for joining this briefing on the Global Index 2021. And I will now present to you the outcomes of this index. So let me first show you which companies are on the index, and you will see that on the next slide. We have assessed 25 companies this time for the 2021 index, which includes the 20 largest food and beverage companies globally by their global revenues, as well as 5 companies that were assessed on previous indexes and that we wanted to reassess to see the progress. I will now talk you through, actually, I think the most important part, the ranking of this year's iteration. I first would like to congratulate Nestlé for being the #1 on the 2021 index. And Nestlé scored 6.7 out of 10. And then Unilever comes second with a score of 6.3, and Friesland Campina scored third with a score of 5.9. I also would like to compliment 2 companies that have made a major increase on the index, because we believe actually that's the most important. It is all about progress. What progress are companies making? And one of the panelists scored this time very high and showed a big improvement, Arla, from 3.3 in 2018 to 5.1 in 2021. And that is why we have invited Arla also today to the panel to explain how they have organized this improvement on nutrition. Also, the Japanese company Meiji rose 5 places on the index and scored 0.8 in 2018 and is now scoring 3.1, which is an increase of 2.3. You see on the index the asterisk, and that is for companies that have not submitted additional data to us. So their analysis is only based on information that is available in the public domain, which might give a limited representation of the efforts that they are doing. I wanted to mention that, and especially for companies that are new on the index, that are first time on the index, that is often a challenging starting point, but we really hope by engaging with these new companies that they will improve over time, step by step. Also important here to mention on this slide is that we have assessed 6 BMS companies in total, and I will come back to that. We have assessed the 9 largest BMS companies, and the companies that you see with the BMS sign on this ranking figure have been assessed on BMS, and based on their compliance with the international code, their score have been adjusted and there have been taken place a deduction on their overall score to reference the incidences of non-compliance with the code. So I started with the good news, the high scoring companies, but this is all good news. Actually, no. Because if you look at the average score between 2018 and 2021, there has been an increase of 0.3. So the score, the average score moved from 3.3 to 3.6 on a scale to 10. That shows that we still have a lot of work to do. And this index is also a call to action to the leading companies, the top 10 companies, because all the top 10 companies, except for Arla, scored slightly lower than in 2018. And we really hope, and especially in this year of nutrition, that the leading companies will make extra commitments to work on nutrition. On the other hand, and that is on the next slide, we also see that the methodology has changed. So the methodology is in certain aspects more demanding this year. An index, of course, is not static. An index needs to follow the developments in the international community. So we follow the international standards. So there have been made some changes. For example, we now have included the assessment of the nutritional quality of the products into the assessment and also into the overall index score. We've also changed the way we approach undernutrition. In the past, that used to be a separate sub-ranking that was only applied for companies that are active in low and middle income countries. Now we've set for all companies, all global companies, that they need to look at priority populations, groups that are at risk of malnutrition or are suffering from malnutrition already. And these companies are all asked to make a strategy on how they can provide healthier foods to these vulnerable consumer groups. And that might be different per country. So for example, in Japan, there is a focus on the aging population. So the companies are asked to find nutrition solutions for the elderly. But for companies active in low and middle income countries, it is about the poorer consumers in the rural areas. So we really have increased the bar in this perspective. And also the weighting of the categories have changed. We have put more significance, more weighting on the product part, and that has, of course, also influenced the other categories. So let me now brief you on the results, and I will start with actually category A, which is about governance. The average score on governance is 4.6 out of 10. We see that companies that score high in this area also score high on other categories. So it is really important to start with a good nutrition strategy and to have a good monitoring and management system to follow within the company what is happening on nutrition, even to ensure that the responsibility for nutrition is embedded on the executive or most senior level within the companies. And we also see as a best practice to link executive pay to the performance on nutrition objectives, because if it is really embedded in the management systems, it tends to be that companies start to work harder on the nutrition goals. The good news is that 13 of the 22 companies that were assessed in 2018 have now strengthened their nutrition policies and management systems. So we see improvement, although the average score is slightly lower compared to 2018, but we see that many companies have focused on this important topic. Then category B, which is about products. And as I mentioned, this category has really changed compared to 2018. So we still assess companies on whether they have nutrition criteria and whether they work with nutrient profiling models that will assess the nutritional quality of the products that they sell. But we've added the product profile into this category. So the product profile is not a separate assessment anymore, but the score on the product profile is incorporated in the overall score. And the product profile contains now 3 scored elements, which are really focused also on driving change. So first of all, we look at the mean healthiness score. So we work with Health Star Rating, the Australian original Australian system, but which has been used now globally as well, which assesses whether a product is healthy. It assesses negative ingredients like salt and sugar, saturated fat, but it also looks at positive ingredients like fiber, fruits and vegetables. And the mean healthiness score basically concludes whether a product is healthy. So if a product has a health star rating of 3.5 or above, it is considered healthy. But we've not only looked at the inherent healthiness of the product, we've also looked at whether companies that do have products in a same product category as their competitors or peers, whether they are doing better than their peers. So that is what we call the within product category performance, because we've seen in the past that, for example, if you look at confectionery, which is of course considered unhealthy, but still there are levels of difference between companies in the unhealthiness. So the level of sugar might still vary. So if a company is relatively healthier than its competitors in the same product groups, we give credit to that. And then the third scored element, and of course our index is all about this, is about change. So we give credit to a company that is able to make change in the mean health star rating. A company can do that by reformulating, by developing new products, by mergers and acquisitions of healthier product divisions, or divesting in unhealthy foods. And we've seen companies, 9 companies have really been able to make progress in this area. We've also seen that 19 companies now make commitments on reformulation of products at nutrient level. And we have also seen evidence of 9 companies that have a formal statement on their fortification approach to follow international standards, because of course we want companies, when they are fortifying their foods, to do that on international standards based. Good to mention that this time we have assessed many more products on their healthiness than in 2018, almost twice as many. So we have assessed almost 40,000 products of these 25 companies. Next slide, please. If you look at the product profile itself, we have seen that now 31% of the products assessed meet a healthy threshold, so a health star rating of 3.5 stars or more, which of course shows that there still is a major challenge. And I already mentioned that 9 companies have been able to show progress between 2018 and 2021. We really hope that in the next iteration, the number of healthy products has increased. 2 years might be short, although some companies have been able to make progress in the 2-year cycle, but we believe that in a 4-year cycle, it should be feasible for all companies to make progress on their product portfolio. The 31% is the same as in the 2018 index, but again, good to mention that we've now assessed twice as many products. So the picture is much more complete, and also we've seen that companies have provided us with more detailed data. So the picture is also more accurate and is really now a representation of the global sales of the company. So we have a very good basis to continue monitoring in the future. Next slide. So to conclude on category B, on the recommendations, we really hope that companies will disclose nutrient information for all products. We've seen best practices in that, and you can find those in the report. And also that companies improve on disclosure on the healthiness of their product portfolios, and of course start and continue with using smart targets on their key nutrients, so that all stakeholders are aware of the progress companies are making. Then I would like to go to category C, which is about accessibility and affordability. And this is really an area of concern, and specifically in the COVID-19 era. It has always been a very low scoring category. This time companies score on average 1.9 out of 10. This category is about what companies are doing to making healthier options available and affordable for consumers, and especially for vulnerable consumers. COVID-19 has shown that there are really a lot of inequities and vulnerable consumer groups that are in need of healthier options that are fortified with micronutrients that are needed in poorer countries, but also actually on a global basis. And we see that there is really little evidence, if you look at all the companies, of a strategic global approach to pricing and distributions. There are exceptions. I think it is good to mention Friesland Campina, that really has a specific program targeting low-income countries like Nigeria and Pakistan and Indonesia, where they have a very concrete strategy to make sure that healthier options in smaller packaging, but also with the right fortification, are affordable for poorer consumers. And they also set very concrete targets, sales targets against it. So we really hope that these food and beverage companies, all of them, will focus more on accessibility and affordability. Category D is about marketing, and we have seen that most companies now have a marketing policy specifically covering children. A few are still lacking it, but we see a couple of points of attention here. First of all, we want companies to do more about marketing of healthier products to ensure that inequities are overcome. So more focus in the strategy on how can we ensure that poorer or more vulnerable consumers get healthier products marketed. Also, we believe that there should be more attention to the older children. So many of the companies only focus on children up to 12 years. I should say almost all the companies. Arla has an exception here. They have a definition of children as persons under the age of 18 years, which is considered a best practice internationally and recommended by international organizations. And also, and you can find that in our COVID-19 reports, the COVID pandemic has shown new practices of marketing of unhealthy foods, a lot of online marketing, which are also reaching children. So that is definitely a point of attention that we will follow and also, if needed, embed in our future methodology. Category E is about lifestyles, and this is about lifestyles, promoting a healthy lifestyle for consumers in general, but specifically companies have, of course, a responsibility towards their own employees. And now for the first time, we have expanded that to the supply chain more broadly. And companies do mostly make a commitment to improve the health and wellness of their employees. So we see that there are programs designed to address physical or mental health and nutrition. So that is a good a good activity from the companies. But we see that only 9 companies so far have stated their intention to address health and well-being in the wider value chain. And we see some best practices there. For example, Unilever working with GAIN and IDH to work on good nutrition education for their workers on the tea sector. But this is very limited and in the early stages. So we really hope that there will be more attention to the supply chain, because again, COVID-19 has shown how important it is to have resilient supply chains. And ATNi will do a specific action research project in the course of this year that focuses on workforce nutrition, not only own employees, but also the supply chain. And we hope to present that at the Nutrition for Growth Summit later this year. Another area of attention here is, of course, the support for breastfeeding mothers in the workplace. It differs across countries. The majority of the companies do not yet have a global policy that is equally applied in all markets, which we see as an imperative or best practice. Category F is about labeling, and what is good to see there is that between 2018 and 2021, more companies, so we have now 6 companies that have introduced interpretive labeling for some of all their products. And labeling is very important because that, of course, provides the information to the consumers, and labels are also sometimes very complex and difficult to understand. So interpretive labeling makes the label more visual, easier to understand for consumers, whether they are making a healthy choice or not. So we're really pleased to see this progress, and we encourage the other companies also to work on further interpretive labeling, and also to commit only to use health and nutrition claims on products that are determined to be healthy. And again, with COVID-19, we've seen a lot of claims around immunity and other health claims. And it is really important that those claims, and especially also for fortified foods, are only linked to well, an objective healthiness assessment. Category G is about lobbying. So we see more companies showing what they are doing on lobbying, and we believe that that is essential. Of course, there has been a lot of attention over the last couple of years about negative lobbying against public health of companies, and we believe the only way we can solve this is by making transparent what companies are doing in lobbying. So that's the reason why we are starting assessments against the responsible lobbying framework, and we will continue to do more around making companies lobbying practices transparent and disclose what they are doing. And we embed that also in our methodology. We see now that 10 more companies are disclosing lobbying positions, which are important because that's the starting point then for scrutiny and dialogue with other stakeholders. And we really hope that we can increase the transparency in this area. Then I would like to say a few words on BMS. I already mentioned it in my introduction. So for this iteration, we have assessed 9 companies. The plan is to expand the scope. So we're very pleased with the support also of the Bill and Melinda Gates Foundation to expand the scope in future to 20 BMS companies in the next iteration. So there will be more, also smaller producers assessed. And we assess them against the code. And then you see on the next slide that there is still a long way to go, although there are differences. Some companies are doing better than others. The scores of the highest scoring companies are higher than the companies that score 0% or low. We believe that companies should really focus on further code compliance, because breastfeeding is crucial, especially in the first 1,000 days. It is important to have a good, healthy basis, and breastfeeding is helping that. So we really urge the BMS companies to make further steps. Of course, regulation in line with the code is important and will definitely lead further code compliance. But we also want to do a call to action to the companies to start making further steps towards code compliance. To summarize, so I already mentioned the average score is 3.3. If you look at the companies that were on the 2018 index, it's now 3.6. So there is still a long way to go. We see a lot of progress in various areas, so we really hope that this report helps to create inspiration and best practices for companies to improve. And that brings me to my final slide, amplifying impact. And there, this is a call to action to all of you on this webinar, and I'm really happy that you're all there, because we must do this together. We need, of course, the companies. Our index is focused on companies. We need the companies to make further change towards those 2 SDGs, ending hunger and good health and well-being for all. But we also need the investors, we need civil society organizations, we need UN organizations to go into dialogue based on our data with these companies. Where are the gaps, and how can we all work together to ensure that we are bridging those gaps? And this is a crucial year to do it. I think we have a major opportunity. So I really hope that our index provides a lot of inspiration for commitments to make at the UN Food Systems Summit, as well as the Nutrition for Growth Summit. Thank you very much.
Thank you, Inge, for sharing this overview with us, and also thank you for a really clear call to action for all companies in the 2021 index. In the next 20 minutes, we have our panelists who will first share their thoughts on the presentation made by Inge and the Global Index 2021 findings. So in the following order, we have Han Sundegaard from Arla, then we have Frank Wagemans from Achmea Investment Management, followed by Dr. Rajan Sankar from Tata Trust and also member of the ATNi board, and we have Gronya Mary Moloney of UNICEF. Let me first turn then to Han. Welcome, Han, and congratulations with Arla's big improvement this year in the index. Inge already mentioned that, and well, of course, we are all very interested to hear from you whether you can share some more of your experiences with addressing nutrition challenges, and also what role the Global Index has played for a company like Arla in your road to better nutrition. Please, Han.
Thank you very much, and I'm very pleased, honored, and also a little bit humbled to be here. So my name is Han Sundegaard. I'm PMO responsible for marketing, innovation, and sustainability at Arla. We are a dairy cooperative across 7 European countries with farmers, but obviously operating across a lot more markets. We have a sustainability strategy where we work with what we call stronger people and stronger planet. And a lot of the work we do around nutrition is centered within what we call the stronger people part of our strategy. I think if I should address the first question first, what are we doing as part of working with nutrition inside Arla? I think where we can have impact is very much on our products. So we work a lot with innovating for healthier products. We also believe we can have an impact around inspiring people to make healthier choices, particularly in some of our core markets. And then thirdly, of course, as has already been said, making products affordable, so making good nutrition affordable, both for our European markets, where we have the biggest part of our business, but also for some of our further field markets like Nigeria, Bangladesh, and Southeast Asia. I think the foundation of all of this for us is our nutritional requirements, which we've had in place for some time. And I think that's, for us, a very important foundation. It gives us something to navigate with as we innovate, and also as we sort of internally have clear policies around the fact that you cannot make, to the point that was made earlier, nutritional claims unless products live up to those requirements. The second part of our foundation, I would say, is around what we call the reformulation program. So as far as we can take sugar, salt, and fat out of our products so we have a good nutritional profiling. And then the third element that we call our foundation is very much research. We have a setup with universities that we call Arla Foods for Health. So this is where we develop our research around nutrition and health. I guess in terms of the changes that we've made and also working with ATNi, I think what has been really good for us is actually to work with you on understanding, what is it? How can you help us to understand what we need to do to also get better? So that joint working, I think, is a strong part of it. Is in three areas. One is around our portfolio. I think that's part of our improvement, is the improvement in the nutritional quality of our portfolio. I think the second part is around what I would call transparency. And I know, for example, we needed in a number of places to get stronger policies in place, and that's what we've been working with. One of the areas has been around labeling policy, front and back of pack, to be transparent, but also help consumers making some good choices around nutrition. I think the third element is very much around our responsible marketing policy for us. And I think the reason why we've chosen, as was mentioned earlier, a policy that goes up to 18 is I think because we are a dairy company, we feed a lot of children, right? And I think it's very important for us that we do that well, and we take responsibility for the healthiness of the next generation coming. So we've introduced this responsible marketing policy internally. We've joined also the EU pledge to help them help us on how we also work with compliance and training of people internally around this policy. And I think we actually were doing quite a lot of work working with kids and teenagers in camps, etc., around how we build their understanding of where food comes from, what's healthy, what's nutritious, how they cook. But I think we needed to do it at scale across the whole of our business, which is what the responsible marketing policy helped us do. So I think that's probably, Margie, what I would present.
Yes, thank you very much, Hannah. And well, one of the ways, of course, that ATNi tries to influence companies is also to share best practices. So this is really appreciated. So thank you very much. I'd like to go to the next speaker, who is Frank Wagemans. Frank is working for an investment company and part of our investors' signatories. And we're very, well, the investors' signatories are an important group for ATNi also to influence change. So we're very much interested to hear more from you why nutrition is a relevant topic to institutional investors with holdings in the companies, and also what exactly the risks and opportunities of investing in these companies are. And then maybe if you still have some time to also discuss a little bit on the engagement process that the investor signatories are preparing for with the companies in the index. Thank you.
Yeah, thank you. Thank you for having me. Just a little background. I work for Achmea Investment Management. We have over 205 billion euros assets under management. That's not our money. So in a sense, it's part of Achmea, which is a healthcare insurance provider. But we also work for a wide range of Dutch pension funds, of which several are very firmly grounded in the healthcare sector. So healthy nutrition is a theme very close to our heart. So in that sense, it is a logical topic for us as investors to move forward on. Well, first of all, food and beverage it's a product we all use worldwide in all the different countries, in all the different age groups. So the nutritional side is very important for everybody. It's a very clear link with the sustainable development goals. So it's, from a societal point of view, it's a very logical point for investors to move forward on. But the interesting thing is that it's also aligns with a sound business and investor perspective. We see that the food and beverage sector is a very solid part of every investment portfolio. And we think it's important as a company to move forward, to be on the ball, to have a strategy on this goal, and to being a leader and retain market share. especially because we see that there is an increasing demand of consumers to eat more healthier food. We see increasing regulation, such as sugar taxes. So we think it's a topic which should be top of mind of every board of a food and beverage company. And last but not least, as investors, we do not only invest in food and beverage companies. We are, well, as it's called, universal owners. So we have shares and bonds in very wide range of companies and countries. So we also see that the detrimental impact of bad nutrition also translates to other companies. For example, by having more sick employees impacts business. We see that bad nutrition impacts GDP. So also from an investor point of view, not only for the food and beverage companies, but for the wider economy, it makes sense for investors to move forward on this topic. So that means companies should take steps forward, but also we as investors, by taking into account the outcomes of the Access to Nutrition Index into our investment process, but maybe even more important as being active owners, having shares, having voting rights, to nudge and sometimes push companies to take that extra step. And I'm very pleased as being the co-chair of the investor group that the number of investors being a signatory to Access to Nutrition has grown very, very quickly. So I think the investor coalition represents 15.5 trillion USD assets under management, which, well, is quite sizable in a sense. And I'm also very pleased that with this group, we will engage companies on the outcomes. And sometimes that will be a little bit nudging, sometimes that will be a constructive discussion on how a company can move forward, and sometimes it can be a little bit more pushy if we really see that a company is lagging in a sense. And when I look back to the engagement we had over the 2018 index, I'm also very positive about the engagement which is coming up now, because we see that the outcomes of Access to Nutrition are accepted by the companies themselves, which enables a very constructive dialogue with companies. Where are they lagging? Where can they move forward? And what are the best practices within the sector that companies can adopt and move forward to? Maybe also, maybe as also shown in the outcomes of the index, we see differences. So we see companies that are really eager to move forward, but we also see companies that don't really have a strategy, don't have very much insights in a product portfolio. And so there's also for us and the companies really the need to step up our efforts, because if you don't have a strategy, if you don't have a solid product portfolio, you are just lagging behind. It has a detrimental impact on society and a detrimental impact also on the financial outcomes. So concluding, as investors, we are very happy with the launch. We want to congratulate the whole team and everybody who worked on this research. And we are very glad to use the outcomes in the engagement process, which will start or continue well from the next week's on. Many thanks again, and pleased to be here.
Thank you very much, Frank. And well, likewise, we're really happy to have you and also the other investor signatories on board. And of course, also we hope to grow that group in the future to increase our impact in working with the investors and reaching out to companies that way. We have to go to the next speaker, and this is Dr. Rajan Sankar. Working for Director of Data Trust Nutrition, and we're really happy to have you here, Dr. Sankar, particularly because we also like to shed some light on on other markets than the home markets of the companies. Most of the companies are European, American companies. We have a few, of course, a growing group of Asian companies as well. And well, one of the key outcomes of the index is also that we like companies to do more on accessibility and affordability for different groups, consumer groups at risk, and to do see how they can improve in value chains. And we are particularly interested to know what you see from your experience in Asia, and then particularly in India, where you are working. And I'll give you the floor to share some words with us. Thank you.
Thank you, Maria. Good evening. At the outset, I'd like to place and record my sincere gratitude to ATNi for this opportunity. And I'd also like to congratulate ATNi and the whole team for this impressive information-packed newer edition of your Global Index 2021. I'll be more broad. I think the details of what is there in the report and the progress has been given, but I would just like to touch more on the relevance of these and the kind of problem that we face globally with malnutrition. It was alluded to earlier, the relevance is very high. The COVID pandemic has only worsened the situation, and the predictions are even more dire and even scary. Even we need significant investments in the right direction to even reach the pre-pandemic levels. We know that global malnutrition continues as a global challenge with a very huge social and economic cost. And we heard that nearly every country faces a public health challenge, whether from undernutrition, overweight, obesity, and micronutrient deficiencies. But we are seeing a new phenomenon of coexistence of undernutrition and overnutrition occurring side by side in low and middle income countries. And we call this as double burden or triple burden. And this is growing amongst individuals, families, and in many of these countries. Historically, overweight and obesity were viewed as the problems of middle and high income population, but no longer it can be labeled as a disease of affluence. Let me highlight this with some statistics from India. India has the largest number of children and adolescents with undernutrition in the world. A third of the world's stunted children live in India. But the country also has the second largest number of overweight, obese children in the world. And if this trend continues, soon it will overtake China to be the country with the largest number of overweight, obese kids in the world. Just to give you the perspective in terms of numbers, in 1975, there were just 11 million children and adolescents in the world who were obese. By 2016, the number has increased to 124 million. It's just a more than tenfold increase. What is driving this? There are many things, of course. Malnutrition, as we know, is a final outcome of a combination of determinants clustered into food, health, and care. But the food environment emerges as one of the most important driver. And we know that the diet quality is poor for 1 in 3 across the world. Around the world, the rich countries, poor countries, everywhere. And more people are dependent on markets for their food needs. And what is easily available and affordable, unfortunately, is calorie-rich but nutrient-poor foods. Even in low-income countries, most people get food from the market, and urbanization is driving consumption of highly processed foods. 6 of the top 11 risk factors driving global burden of disease are related to diet. Unfortunately, healthy diet is expensive. Even in the report, we see that FAO has said that a healthy diet costs 5 times as much as energy-dense diets that meet only energy requirements. So this shows the kind of problem that we face. If we want to ensure that people consume healthier food, we should ensure that there is a healthy food environment. Improving the food environment will require concerted work across a wide range of sectors. Tackling malnutrition is important. It's also an economic imperative. There's also huge social costs that are even higher. Poor diets negatively impact neurodevelopment, with dramatic consequences on children's academic performance, careers, and earning potential. The food industry plays an important role in changing many of this. They provide products that meet consumers' needs in terms of taste and convenience. They could do more to help shape demand for nutritious foods, could bring more nutritious and safe foods to market at lower cost and take them to scale. The companies could reformulate products to make them less harmful and higher nutrient density and more. That's precisely what efforts like ATNi's Global Index try to do. And this index is a powerful mechanism towards strengthening accountability infrastructure. It helps expand public dialogue. It helps working together to establish trust and collective solution. I believe this edition of Global Index has once again brought the role of food businesses center stage and why and how they could help address malnutrition in all its forms. And I've seen, for the question that you asked in India, the kind of enthusiasm with which companies participated in the second edition, and they're already making changes internally and even consulting outside as to how they can improve. That's a very good point. And I congratulate the team once again, and thank you for the opportunity.
Thank you very much, Rajan. Yes, and we are also looking forward, of course, to the next iteration of the India Index, which we will start the consultations of later this year. Let me now go to the next speaker, who is Gronya. She's working for UNICEF, and we have asked you specifically also to share your thoughts on health and nutrition of young children. 45% of child deaths are associated with undernutrition, and research shows that the impact of COVID-19 on children will also be significant. So please, the floor is yours, and we're looking forward to hear also your thought on what the role of companies is in fighting malnutrition amongst children. Please.
Thank you, Marie. Good morning, good afternoon, colleagues from New York. 40 years ago, the International Code of Marketing of Breast Milk Substitutes was adopted to safeguard the health of our most vulnerable citizens. The code was a response to aggressive marketing activities of certain companies that own and produce breast milk substitutes. These practices had led to a drastic decline in breastfeeding, with potentially catastrophic health implications for children and their mothers. Numerous studies had found that mothers who received free formula samples when discharged from the hospital breastfeed less. Unfortunately, 40 years later, the code remains as important now as it did then. Because despite the fact that it was passed so long ago, not one single breast milk substitute industry globally, including all of those listed on the ATN index, abides fully by the code and the subsequent World Health Assembly resolutions. Optimal nutrition in early childhood must be protected for all children everywhere. The evidence speaks for itself, and core to that is breastfeeding. Breastfeeding is vital to a child's lifelong health. It reduces costs for health facilities, families, and governments. Breastfeeding within the first hour of birth protects newborn babies from infections and saves lives. Babies who are not breastfed are 14 times more likely to die before they reach their first birthday than babies who are exclusively breastfed. Breastfeeding also improves IQ, school readiness, and attendance, and is associated with higher income in adult life. It is singularly the most effective public intervention we have to give all children everywhere the best start in life. It is a great equalizer, and it is also recognized as a human right for mothers and their babies. And yet, despite this powerful and unequaled evidence that is recognized as a human right, aggressive and misleading marketing of breast milk substitutes continues to undermine confidence in breastfeeding and reduce breastfeeding rates, putting both children's and mothers' health at risk. Shockingly, these practices are becoming ever more sophisticated at precisely the moment when, in the face of rising malnutrition rates due to the impact of the COVID-19 pandemic, breastfeeding is becoming even more urgent. To demonstrate the tactics that the breast milk substitutes industry employ, it has actually capitalized on parents' fears during the pandemic. For example, they have distributed formula as emergency supplies in at least 6 countries, despite WHO and UNICEF recommendations to keep breastfeeding even when suspected or known to have COVID-19. We have decades worth of evidence that breastfeeding is the single most effective intervention to prevent child deaths. The importance of breastfeeding is not only limited to low-income countries as well. The lack of breastfeeding increases risks of sudden infant death syndrome, a key cause of infant mortality in high-income countries. Breastfeeding also reduces the chance of obesity and diabetes risk later in life, which is also linked to the risk of increased morbidity from COVID. So while the ATN index is a welcome start to track accountability, it also highlights the lack of any progress of the breast milk substitute and baby food industry 40 years on from the code on the areas that matter. Therefore, today is not a reason to celebrate or be complacent. We must protect our society's most vulnerable from exploitation, and the baby food industry must take their responsibility to the health and well-being of children and women seriously. To do this, we call on all industry and their investor groups after 40 years to finally step up and act as follows. 1, abide by the code and the World Health Assembly resolutions, even in the absence of national laws, and track their progress. This involves stopping all forms of promotion, including advertising of products through their websites. If you check every company on the ATN list, they're all advertising on their websites, as well as all other requirements. Stop opposing government efforts to introduce laws to implement the code and support such efforts when they are proposed. Where laws are in place, ensure compliance and be ready to report on compliance or provide any necessary information as needed. Even in the absence of lobbying restrictions, document and publicize any lobbying or interactions with government. Eliminate any corporate social responsibility efforts related to child nutrition. And finally, change the measures of success away from increased sales of products covered by the code. Thank you very much.
Thank you, Gronya, and thank you also for a strong message on this aspect of the food industry. I'd like to call the panelists together and also Inge in the panel so that we can quickly move to the questions, because there's many questions both in the chat and also the question that were prepared by ATNi's partnering organizations. So first, now that we're on the topic of BMS as well, I'd like to first raise a question also to Inge, because I think that could be answered good from Inge's perspective. And this is a question in the chat that asks or says that it's amazing that Nestlé, who has just openly stated that the majority of its products, 60%, are unhealthy and regularly violate the code and subsequent relevant WHO resolutions, can be ranked top. So how can we explain this?
Thank you, Mariah, and also thank you, Gronya, for bringing up the topic on marketing of breast milk substitutes explicitly. I completely agree, Gronya, that we cannot be complacent, and well, part of our index is also absolutely a call to action for the baby food manufacturers to take action. Since this is a session that is covering all the aspects of the index, so 7 categories from product formulation to labeling to lobbying, indeed, as well as an important topic to workforce nutrition. Unfortunately, we cannot do a deep dive in all the topics, but we had indeed a session on marketing of breast milk substitutes after we published the breast milk substitute index. We now have, for the first time, a standalone BMS index to ensure that we get more attention for this important topic. Still, I think it is important to mention that the results of the BMS index, so the compliance of the companies with the international code, is feeding into this index. So one of the questions I saw in the chat is the methodology right, from Jane Badham? And I think we have a substantial weighting of BMS in the index. So 1.5 point deduction is based on the level of code compliance for the companies. I think we should also look into the future and continue to review whether the weighting of all the categories, all the things that companies can do is good. So that will also be part of the consultation going forward. So for example, based on input from stakeholders, we have increased the weighting on the product category this time from 25 to 35%. So that is a continuous process that we need to take into account. David Clark asked a question also about our future plans for BMS. I already mentioned that we will expand the number of baby food companies in next indexes. So more companies, also smaller baby food producers, will be incorporated. We also have plans to do more on the ground assessments in more countries, because the current approach in which we assess 2 countries is limited, especially if you look that we need to cover 20 companies in the future. So that are all ways to further improve, and we really welcome the input also in the chat, but also besides that to the process, because we find it important. The code, of course, with all the subsequent resolutions is our starting point, but it is really important to get the input, and we are there really to measure the progress. I just want to mention the ranking is there also, the BMS ranking, to show the difference between companies. So I do not agree with the point that there is no progress at all. We have seen progress, and we also see differences between the companies. We still have a long way to go, and we cannot wait with taking actions, and we can also not wait for regulation. But just that nuance, that there are differences between companies, and that is exactly what the ranking wants to bring into the discussion. Then there was a question on Nestlé. It is right that Nestlé also within our scores 57% healthiness, if you look at it sales weighted. But again, I want to mention that our index is measuring on several areas. Nestlé is scoring high in several of the categories. And also, I just want to mention that Nestlé is one of the 9 companies really improving their portfolio over time. So they have divested in certain ice cream and confectionery business, which has led to credit in the category B category. Just some input, but I can continue to talk, and I want to give the floor to the panelists, the other panelists. But just some input from my side, and please do not stop asking questions. And we're not afraid of any questions. We are there for the dialogue. Thank you.
Thank you, Inge, and definitely this discussion and also our engagement with all our stakeholders will continue over the next couple of months to also discuss more about these outcomes. But also to raise another topic, I'd like to go to the question that was submitted by the World Benchmarking Alliance by Victoria de Bourbon de Parme, who is the food transformation lead at the World Benchmarking Alliance. And I'd like to pose this question to Frank. They're stating, the WBA is stating the index results are showing very low performance and limited progress on accessibility and affordability, while this is crucial to reduce food insecurity, and specifically in the after the COVID-19 pandemic. So although these are very complex issues that cannot be solved only by companies, but what role can investors and also civil society play in pushing food companies to take more responsibility and improve their strategies to increase access to affordable, healthy diets? Yeah,
thank you for the question. maybe I will try to answer several questions at once, because one of the comments was also, hey, we see several leading companies. Are they done yet? And I think the accessibility theme is especially for, let's say, the top 5 is a topic in which they are lagging still. So you see some companies who have strategies and policies and make steps, sometimes baby steps, sometimes bigger steps in a product portfolio. But the accessibility part is, I think, a sort of general topic in which, well, especially the laggers, but also the leading companies are really lagging. So with one of the companies who have a high score on the index, we had exactly this discussion. They have a strategy, they have a KPI, but they have not translated this to what does this mean in a market as like the US or India or Nigeria. So especially on this, I think companies can make the step to translate their own strategy to what does that mean in actual markets. And sometimes that means that you have a sort of special emphasis on pricing of special of specific products, sometimes on the serving side, sometimes about micronutrients. So I think translating the findings and the goals you have as a company to the different markets, leading to healthier products, but especially to accessibility, which can mean different pricing, different service servings, different marketing, different labels. I think it's a very important point in which companies still need to move forward.
Thank you, Frank. And perhaps, Hannah, you would like to add to this and also say, maybe also respond to the question that was posed by Sharon Bly, who is the Health and Wellness Director at the Consumer Goods Forum, who's asking what needs to happen to drive even more importance for companies to put nutrition higher on the agenda, and then in relation also to accessibility and affordability. Well, please feel free to respond, because there's many questions in the room, so please go ahead.
Yeah. So I was actually just reflecting as Frank was talking there. I think for us, and I have to be honest, the majority of our business is in Europe, so I'll be very honest here, where you know, if we talk about the markets where there is a particular need, not that there is not a food poverty issue in Europe, there is. But if we talk about the markets that we're in where there is a particular need, then I think also working with local governments, apart from the portfolio itself, I think working with local governments also on, you know, how do we get the right nutrition to people? And I think the example that we are working with the most is in Bangladesh and Nigeria. And then I think the cooperation with local governments is key also for us to bring affordable nutrition to more people. I think that's the key. In terms of what is needed for companies to do more, I actually think working together with local organizations and companies like ours is a key point, and that goes for us and it goes for those organizations that we work with. I think the other thing is innovation and technology. So one thing that we are working a lot with is how can we make products affordable but still nutritious, right? So how can we get that balance right all the time? And what is the alternative for local people? So getting that right, and we are working a lot with also plant-based ingredients. How can we bring good nutrition at the same time as affordable nutrition? I think that technology part, and then maybe some of the technologies also around cell-based proteins, whatever it is, that may come into play here. But of course, we need to make sure that they are good. So I think technologies and cooperation, I think, are the key things that we need to work with as businesses.
Thank you, Hannah. And yeah, so there's a lot still to do, and also a lot of topics that still requires more action research, more discussions, more developments, and also developing of international standards and guidelines that can help us all to move to a next step. And I'm really sorry, but we're running out of time, and I really wanted to still discuss a question from Gain that asked more about fortification and what is the next step on fortification. What role can the food and beverage industry play in this regard? But also indeed child obesity and overweight. What can we further do on this? ATNi has one of the strategy pillars is developing more knowledge and do action research on various of these topics, and that's what we're going to do the coming time. And we're looking forward to have more discussions and inputs from your end as well on all these different topics. But I have to go to the next speaker, because he's waiting for doing the closing session. So may I now invite Shelley Sundberg, who is Senior Program Officer for Nutrition at the Bill and Melinda Gates Foundation. And I give you the floor. And of course, I thank the panelists very much for their time, for preparing their speeches, and for answering questions in this discussion. We're looking forward to discuss more in the near future. Shelley, now it's over to you. Thank you.
Thank you very much, Mariah. The Gates Foundation is honored to have supported ATNi since its inception, and today's launch is a great indication of how the Global Index has evolved over time. One of the key achievements of ATNi is that it has established a unique position within the global nutrition community as an honest broker between private and public sector actors. The Global Index is the culmination of those efforts, recognizing companies for their actions, highlighting areas where progress is still needed, and bringing neutral and transparent reporting to important stakeholders, including the food and beverage industry, investors, and consumers. As a result of the Global Index work over these the last decade, we've witnessed company performance improve as leaders act on the findings and set specific targets to improve their rank and standing within the report. And while it is encouraging to see several companies with improved scores, much still needs to be done. The COVID-19 pandemic and the future post-pandemic context require accelerated and sustained action from the food and beverage industry. Policies and actions by the companies assessed in the index have the potential to address and improve all forms of malnutrition, from increasing the offerings of affordable products that help address nutritional deficiencies, to adopting the types of marketing behaviors that help to establish a supportive environment for early and exclusive breastfeeding, as just explained by Dr. Maloney in the comments from UNICEF. We welcome the recent changes in the index methodology that place greater emphasis on the healthiness of products and recognize companies that engage in new product development and reformulation to improve product healthiness and diverge from unhealthy product lines. However, the fact that we heard today that only 31% of 38,000 products sold by the 25 assessed companies in the index can be considered healthy demonstrates that there is significant room for improvement. And as emphasized by Dr. Shankar, in a world where populations increasingly depend on markets and to procure their food, the affordability and quality of these food products is vital to global health. We are also pleased to see that the most recent index assesses companies' impact on populations at high risk of undernutrition, as explained by Inge. It is also encouraging to see the increased number of companies committed to follow international guidance on food fortification set by Codex, WHO, and FAO to help ensure that this core intervention can achieve its intended health benefits. Companies are increasingly recognizing their roles as global citizens, contributing to the achievement of broader societal objectives in addition to maximizing profits, particularly through their core business. In this regard, it is vitally important for companies to be fully transparent regarding their positions on government health and nutrition policies, as ATNi calls for in their recommendations in this year's index. As always, it takes all of us making the best use of ATNi's work to ensure that it achieves its highest impact company commitment to acting on the results of the ATNi Global Index is foundational to its success. We hope that investors review the results and work with company leaders to make meaningful changes to improve their scores. Civil society actors are needed to increase awareness of company practices and, where appropriate, celebrate advancement towards better health and nutrition. Leveraging the results of the Global Index and awareness campaigns can help consumers recognize and spur continued company commitments to healthier products and responsible practices. Everyone can win from increased efforts to ensure that affordable, nutritious food is available for all. During this year's Year of Action for Nutrition, it is even more apparent what a unique and critical role ATNi plays within the broader nutrition community, providing the only independent assessment of the largest food and beverage companies. ATNi's analysis helps to inform global dialogue and pledging events, while also providing critical information for the commitment mobilization at all levels to address nutrition. Advocates will use the findings to encourage specific and measurable commitments from food and beverage companies ahead of the Nutrition for Growth Summit in Tokyo in December 2021. For all these reasons, the Gates Foundation is happy to continue supporting ATNi's work for the next several years. ATNi remains a valued partner of the foundation across our nutrition, agriculture, and maternal and child health work. We are supporting ATNi to deliver on its central mission while expanding to include new elements around the adoption and compliance with fortification standards, and also to strengthen support for breastfeeding by assessing a broader set of VMS companies going forward. Our hope is that companies, especially, as well as investors and civil society, will continue to leverage the tools developed by ATNi so together we can push for a healthy future for all, particularly for those who are most vulnerable. On behalf of the Bill and Melinda Gates Foundation, congratulations again on this important launch event, and we look forward to partnering with ATNi in the work to come. Thank you very much. And back to you, Mariah.
Thank you so much, Shelley. And yes, we're also looking forward to collaborating in the years to come on all these important topics. Today's launch event has come to an end, and I want to thank everyone, our audience, our speakers, everyone who has contributed to launching and publishing this index. All our reports, of course, there's so much more to tell. All our reports are published on our website. And also our contact details, of course, are on our website. So if you want to discuss more, want to reach out to us, want to work with us, you can contact us through our website contact details. And we're very much looking forward in the months to come towards the big nutrition summits to discuss and develop much more knowledge on nutrition. And definitely looking forward to the next indexes that will come later this year, the US index, and early next year, the UK retail index. Thank you very much. And we're looking forward to see you soon. Bye-bye.
Malnutrition in some form affects every country in the world.
1 in 9 people is hungry or undernourished.
1 in 3 people is overweight or living with obesity.
2 billion people lack essential micronutrients such as iron, vitamin A, vitamin D, and zinc in their diets.
Over 800,000 infant deaths could be avoided each year if they were optimally breastfed. COVID-19 has exacerbated all forms of malnutrition.
Women, children, marginalized and low-income groups are most at risk of malnutrition.
It is estimated that by 2022, the pandemic might lead to a 2.6 million increase in stunted children.
With a retail value of nearly $2.5 trillion in 2020 and a scope that reaches virtually every individual on the planet, the packaged foods industry has a significant impact on nutrition globally.
The Nutrition Year of Action comes at the right time to urgently transform food systems and promote better diets for all.
ATNi is a non-profit organization that develops tools to track the contribution of the food and beverage sector to address the global nutrition crisis. Our engagement with companies and other parties are all focused on driving positive change.
ATNi's strategy involves 4 work streams.
Our global indexes provide comprehensive analysis and ranking of the world's largest food and beverage manufacturers in addressing the global nutrition crisis. Each index includes an assessment of each company's product portfolio. For baby food companies, it also includes an assessment of the marketing of breast milk substitutes and complementary foods.
ATNi develops accountability tools and programs targeting large and small companies in individual countries. ATNi collaborates with organizations to produce specialized accountability tools and research to feed into existing benchmarks and initiatives.
Finally, ATNi engages in action research to zoom in on new nutrition topics and develop knowledge to fit into new indexes and tools.
Institutional investors are key users of our work. ATNi has over 70 investor signatories with $15.5 trillion in assets under management, who use the results of our indexes in their research and engagement to guide responsible investment.
With a growing number of impactful publications, ATNi is a unique global accountability organization for business action on nutrition.
ATNi invites you to use our tools to drive change towards a vision of the world where nobody goes to bed hungry.
A world where everyone eats a healthy,
affordable diet that has all the nutrients needed
to grow and develop fully.